The reason I started to look into comparing falls in private rooms versus non-private rooms is because there is an industry standard right now in architecture or construction of new facilities that requires us to build them with all private rooms. For the elderly patient population in particular, they seem to enjoy the semi-private room, one for socialization, but two because they look out for each other. And often you will go in a room and you will hear one patient say that the other patient might get a little confused at night and that they'll call the nurse to come in or remind them that they're not allowed to get out of bed alone. So I started wondering, particularly given the research that is very explicit in that most falls, almost all, occur when a patient is alone in the room. What is the difference between a private and a semi-private room? Falls are a personal interest for each and every chief nursing officer, largely because falls, as a nursing sensitive indicator, are felt to be 100% preventable by nursing interventions. These falls occur largely because patients, especially the elderly patients, are vulnerable, they're deconditioned, they spend a lot of time in bed, they're weak, and then they have a physical need that they need to take care of, and they don't ask for assistance, so they get up. If you're getting out of bed at home, you pretty much know where everything is and you're making your way to your bathroom. But in the hospital, there's unfamiliar chairs, there might be a table, poor lighting, and the elderly have less acute vision. The data set that I collected is unique in that it came from a population of patients at Princeton Healthcare System from January of 2006 to April of 2006. It was actually a retrospective study, so it was charts that were identified or came from medical records that we looked through that were all patients over the age of 65, but excluded those patients who were admitted directly from nursing homes, who were incontinent, who had a diagnosis of dementia, and who were isolated for infection. The reason those patients were excluded because I was really looking to see if there was a difference in falls between patients who were taken care of in private rooms versus semi-private rooms, and I didn't want to include patients who had a much higher risk of falling. So I was looking at the healthy elderly population. Patients don't actually assist the other patient to the bathroom in a non-private room. What typically happens is that patients in non-private rooms will look out for each other. So if one patient starts to get out of bed and the other patient knows they're not supposed to get up without assistance, they'll notify a caregiver to come in and assist. Falls are a complex problem in hospitals and clearly are a threat to patient safety. So there are many areas that need to be studied so that we can determine which interventions can be applied in order to prevent falls and to decrease injuries from falls. And it really is complicated because it's not just one thing. It's not just the type of room. It's not just how nursing care is practiced. Studies that need to be done to prevent falling and prevent injury in the elderly patient population fall into three categories. That includes the environmental design of the patient room, which would include things like adding assistive devices or moving patients' beds closer to the bathroom. It includes risk assessment. There are many risk assessment tools out there. Some are more sensitive than others, but we need to continue to look at those risks and assure that we are looking at the right characteristics to assess patients for fall risk. And thirdly, they need to look at interventions that caregivers provide to patients, which would include things like toileting, rounds, assuring that patients have the appropriate things that they need at their bedside so they're not reaching or having to get out of bed to get a glass of water. One of the things that I am very interested in and will be looking at, particularly with the our new hospital and in the model patient room, which is where we are taping today, is the environment and how we can help a patient be able to assist themselves to the bathroom more easily and give them assistive devices to help them get there. And one of the ways that that can be done is by designing a room where the bathroom is really literally 3 feet away from the bed. In our current hospital and most hospitals, particularly in non-private rooms, patients are very far from the bathroom.